Welcome to Speak Up and Stay Alive RadiOh with author, speaker, and your host, Pat Rouleau. Finally, someone willing and able to blow the top off hidden healthcare and hospital dangers. She's provocative, upbeat, balanced, fearless, fresh. Pat has over 20 years of experience as a professional public speaker and knows how to approach this important subject with enough humor and wit to keep you informed, entertained, and empowered. Each week you will say, "Oh," as Pat explores and exposes little-known hospital hazards, delves into the deep waters of dangerous healthcare practices, picks the brains of her good-looking and influential guests to help keep you and your family safe in today's fragmented healthcare system. The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau, your patient safety radio hostess. Always so excited to share everything I know about how to be a safe patient, especially in today's crazy healthcare system. Well, today I'm going to take you to a behind-the-scenes trip to a microbiologist laboratory to visit Dr. Germ. Bob and I toured the lab in person, and I taped some of it so I could bring it back just for you to hear. And later in the show, Bob is reunited with his fave radio rival, Jeremy, for a fun game of Squeak Up and Stay Alive. We really do have a good time here, even though the subject is serious. It never hurts to inject a little humor into a difficult topic. So, I hope you head for your best listen to the radio seat, close all doors, turn off all ringing devices, and enjoy this important time with me. And to begin, let's discover the hospital hazard of the week. Sleep apnea and anesthesia don't mix. I received an email a few days ago from a Hollywood actor and singer whose mother died of a sleep apnea condition while apparently unsupervised during a hospitalization. He fought to create awareness to this problem and recently persuaded the governor of New Hampshire to issue a proclamation recognizing his mother and to bring attention to the condition known as sleep apnea. So on the heels of that email, let's talk about this today. If you suffer from sleep apnea, you need to be aware of the risks of anesthesia. Sleep apnea is a condition in which a person stops breathing periodically during sleep. And the problem is, most people with sleep apnea don't know they have it. This means that many people who need surgery and therefore need anesthesia are put under without proper measures to avoid complications. This can also be a problem in intensive care units as well. So, what is sleep apnea? Sleep apnea is just one of several common sleep disorders, and the most common form is known as obstructive sleep apnea, in which breathing stops while sleeping. In healthy people, the muscles which work the upper part of the throat ensure that the airflow in and out of the lungs is steady and continuous. But people that have sleep apnea often have airways which are narrow, so that when the throat muscles relax, the airway partially or completely closes, thereby no longer allowing air to pass to the lungs. So, what are the signs of sleep apnea? The most common warning signs include loud snoring, waking in the morning and still feeling tired, headaches in the morning, problems with memory, alterations in personality, falling asleep at inopportune times, hypertension, and in severe cases, swelling of the legs. Also, being overweight and having a large neck are additional signs. In some individuals, breathing can also cease completely during periods of REM, that deep REM sleep. These periods during which breathing ceases can last for 10 seconds or more in severe cases and can be accompanied by choking, gasping, or even snorting. I'm betting that if you sleep with someone else, that person might have a clue that this is a problem. While the symptoms are not life-altering, one should be checked by a doctor to make a firm diagnosis. If your doctor suspects that you have sleep apnea, he or she will refer you for a sleep study in what is called a polysomnogram. This test records eye movement, brain waves, breathing rate, muscle activity, and oxygen levels in the blood, and the quantity of air that's being both exhaled and inhaled during sleep. This is typically done overnight or two in a sleep lab where you are monitored throughout the night. So what are the dangers during a hospital stay? Well, according to a report in the Journal of Medical Association Archives, individuals prone to obstructive sleep apnea syndrome appear to have increased risk of heart, lung, and other complications following surgery procedures because anesthetic agents and pain relievers decrease muscle tone in the upper airways and diminish control of breathing. Based on this knowledge, it is important to identify surgical patients who are at a high risk for obstructive sleep apnea syndrome. In addition, rapid eye movement, that REM sleep, is diminished the night after surgery, and that's followed by a period of REM or REM rebound. The occurrence of breathing problems during REM sleep can consequently triple on the second and third post-operative nights. So what should you do? If you have an upcoming elective surgery and you feel that sleep apnea may be a situation, ask to be tested in a sleep lab prior to surgery. It's best to know about this ahead of time so the anesthesiologist can take special care to keep airways open and closely monitor you during surgery and in the recovery room. Side effects from anesthesia can linger for hours after surgery, so constant care is given to the patient during this time. A continuous positive airway pressure, also known as the CPAP machine, may be used to ensure the airways remain open for a continuous flow of oxygen. If you don't have the time or resources to participate in a sleep study, ask about the Stop Bang questionnaire. I know that sounds weird, but it's an acronym, Stop Bang, for snoring, tiredness during the day, observed sleep apnea, high blood pressure, body mass index, your age, neck circumference, and gender. This is a questionnaire that consists of 8 yes or no questions to assess apnea risk. And keep this in mind, children can have sleep apnea too. Studies have suggested that as many as 25% of children diagnosed with attention deficit hyperactivity disorder may actually have symptoms of obstructive sleep apnea, and much of their learning difficulty and behavior problems can be the consequence of chronic fragmented sleep. Sleep apnea is an all too common sleep disorder which frequently goes unrecognized, but which can be very dangerous when combined with anesthesia. Stay safe. Inform your anesthesiologist, your surgeon, and especially your patient advocate. If any of this conversation rings a bell, please go to the free stuff page at the speakupandstayalive.com website. There you will find a link for more information about sleep apnea. And with that, let's hear some legal news you can use. Listen as I spend the next 2 minutes with Pat Schraff, an elder law attorney at Schraff & King, located on Somme Center Road in Willoughby Hills, Ohio. She always has the answers. Pat, what exactly is elder law?
Elder law focuses on the needs of people primarily 60 and over because there are special things that people need at that point in time that they may not need at other times in their life. And those include a focus on long-term care, estate planning, where will my assets go if I pass away, who will take care of managing my affairs if I pass away, if I become disabled, and focusing also on different types of benefits that may be available or become available as you age, like Medicare, Medicaid, VA benefits, those types of things.
When should a person think about visiting an attorney and discussing elder law issues?
As a person ages, they should consider seeing an elder law attorney. They should consider what they want to happen in the future. They should realize that life does end, and what do they want to happen in that event.
And it might be a good idea for younger family members, children perhaps, to talk with their parents about this and set up an appointment together to take care of some of these issues ahead of time.
That is important, and it's a difficult conversation often for children to raise the issue. So I would urge parents to initiate that conversation, but when they don't, children should sit down and talk to their parents so that their wishes, the parents' wishes, are protected and preserved, and that they can be enforced by the children when the parent is no longer able to make their own choices. There may be a need for powers of attorney for health or for finances. There may be directives like a DNR, healthcare power of attorney, living will. There may be last will and testament, a trust. There are many, many tools in the toolbox of an elder law attorney to assist people in reaching their goals.
Lots of valuable information. I'm sure there's a lot more to know. Pat, how can our listeners find out more about you and Schraff & King?
They can reach us at 440-585-1600 or online at www.schraffking.com.
As usual, it's always a pleasure to visit with you, Pat.
Thank you.
After the show, be sure to visit the website, speakupandstayalive.com, for more life-saving information. Purchase the book that thousands of folks like you have already read. It's called Speak Up and Stay Alive. I wrote it after dreadful personal experiences, 4 years of research, and the desire to help others avoid what I witnessed. Take the book to the hospital with you. Lay it on your bedside table. Just from the cover alone, it is guaranteed to start a conversation with your healthcare providers, and that's important. Let everyone know that you are concerned about hospital safety and infections. You'll no longer be the knee surgery in room 202 or the heart attack in room 301. You will be viewed as an informed and empowered patient. You'll stand out, and that's what you want. Without saying a word, your doctors and nurses will know that you are special. Recently, I received a phone call from a friend in Arizona. She gave a copy of the Speak Up and Stay Alive book to her mom, Naomi, who resides in a nursing home. She said that her mom used to be a social person, but seemed to lately sit in her room by herself, avoiding conversations with other residents. Then she went on to say that one afternoon, while Naomi was reading the book outside in the gazebo garden, a few other women wandered in and sat down. Naturally, upon seeing the cover of the book, they inquired as to what she was reading. Naomi told them and proceeded to read a little snippet from the book. The other women gasped and asked her to read more. Now, it's become a daily afternoon occurrence. Naomi reads short sections from the book out loud to a growing group of 10 residents. My friend just called to thank me for this additional bonus. Her mom now broke out of her quiet shell and has a whole new set of friends. Well, who would have known how the book could impact people? Obviously, I'm pleased and proud that my efforts can help others, and you can help others too. Before a hospital stay pops up unexpectedly in your life, you can purchase the book, Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide. It's found exclusively at the website, speakupandstayalive.com, or it's available in person at all of our speaking events. Buy one for yourself, send one to your future advocate, and keep another handy to give to your doctor, and give them away to family and friends. What a special and highly useful gift idea. And to help your entire group, organization, business, or church stay safe during any healthcare or hospital experience, invite me to speak. Our presentations are lively, interactive, fast-paced, and about as fun as hospital safety can be. Email us at speakupandstayalive.com or call 440-725-5462.
Know you've been a good friend, and that's through the thick and thin, and I know it's never gonna end, 'cause you've been a good friend.
Seniors often have difficulty expressing their needs, desires, and preferences, so they must have someone advocate for them. And who is more qualified for that than their family? Listen as I spend the next 2 minutes with my friend Jack Warren from Comfort Keepers. Jack, you offer a free in-home assessment. Tell us about that service.
In order to start with our service, we ask that you allow us to come into your home, visit with you, understand what your physical limitations are, what your cognitive limitations might be, and understand the safety aspect of your home. So we might have recommendations about the placement of grab bars in the bathroom. Maybe there are some assistive devices that we could recommend for help in the kitchen or for mobility. Once we make these recommendations, we look at developing a plan of care together that meets your needs, satisfies your time requirements, and away we go.
And you have a very cool and free brochure that our listeners should have. Tell us about that.
Absolutely. We have a brochure called 20 Questions to Ask Before Hiring a Home Care Agency. And in this brochure, we have a list of, obviously, 20 questions. Things like, does your agency carry liability coverage? Do you provide 24/7 telephone service? We give you our answers in the column and encourage you to shop other agencies to find out what their answers are as well. So if you would like one of these 20 questions brochures, we'd be happy to send you one free of charge. Please give us a call at our toll-free number, 866-942-1960, and we'll make sure we get one of these in the mail to you right away.
Well, thanks for joining us today, Jack. We look forward to your weekly advice.
Thanks, Pat.
I encourage you to call my friends right here in the Cleveland area, Jack and Bonnie Warren, for more information or to schedule a free in-home consultation. Call them toll-free, 866-942-1960. That's 866-942-1960. Or you can visit them online at comfortkeepers.com. And be sure to let them know that I sent you. Comfort Keepers, keeping the comforts of home.
But you've been a good friend.
This segment is brought to you by Generation America, the smart and traditional 50-plus membership organization, and they provide a full range of benefits to members. If you're looking for a quality Medicare supplement, their rates are lower than the other 50-plus organization, Generation America. To join and to find out more, visit generationamerica.org.
You are listening to Speak Up and Stay Alive Radio. I am your hostess, Pat Rouleau, and each week we bring you an inspiring guest to share his or her expertise. If you've listened to this show for a while, you've heard one of my favorite guests, Dr. Chuck Gerba, the world-renowned microbiologist, also known as Dr. Germ. He's been on this show a few times and probably has the best sense of humor despite the seriousness of the topic. We spent the afternoon touring his labs, the bacteria lab, the virus lab, and met many folks doing important research. We taped part of the tour and thought it would be neat to play some of it for you today. While you cannot see some of the things he talked about, use your imagination and picture piles of petri dishes growing who knows what. He has so much knowledge and information to share, and yet we spent most of the time laughing at his silliness. Listen, I think you'll learn a lot too. So we're in Chuck Gerba's microbiology lab. Well, I see petri dishes and all kinds of good things.
He's the guy studying shoes. He's the one.
He's studying shoes?
He buys his shirts at Goodwill. I've been trying to get him to do that. Today's a relaxed day. Yeah, right.
This is dress down day, huh?
But what he's looking at is how well new antimicrobial mats remove fungi and debris from your shoes. About 93% of the bottom of shoes have fecal bacteria on them and molds and whatnot, because you're always walking in poop without really realizing it all the time. And what he's studying new ways to remove them from your shoes when you enter a building. What they're doing here is looking at water systems that carry water to irrigate produce. And our idea is to try to figure out how E. coli gets into the produce. It's the water that gets there when the crops are growing. And that's kind of, if you've ever seen E. coli, we have a dye in there that turns green when it gets acid. And that's what the bacteria will do when it grows on this media. It smells like, really, most microbiology we do smells like a dirty rag. They grow in dirt. They grow in dirty rag.
They do.
Yeah, those are really pretty. Yeah, those are really nice E. coli. Yeah, that's how they're growing them up here. Make sure I put them in the right order.
Put them in the right order.
Right, yeah, I just goofed the whole experiment.
The experiment is ruined, folks.
But basically, this group is working with bacteria and their survival, their occurrences in, like, schools we were looking at, like on children's desks, on the floor. Where do most bacteria in a schoolroom occur?
Where do you find that? On the desktops?
A desktop, number one, pencil sharpener, because all the kids are there cranking away, computer equipment, computer mouse, sink area in the classroom if they have it. Germia's office space is a school teacher. by 20 more than anybody else. Cheapest, I told you that, right?
Yeah,
Cheapest are lawyers, right?
The attorneys, we were trying to figure that. We said they were out on the golf
in the news media, let me tell you, the germiest are the radio people, sorry to say. And then come the TV, and the cleanest are the print media. Largely because I think their desk is full of paper all the time, so they never get to it from what I've seen on it. But nobody gets to see what you guys look like, right? So you can eat coffee, meals there.
What you're saying is exactly true. When we go in with the bleach wipes, Bob and I do, before we record a show, and when I wipe the surfaces, they're black with dirt. So, yeah, like you say, no one gets to see them.
Yeah, nobody gets to see a radio person, so they can, that's what we've seen. I've been amazed. I've seen people make their meals while they're doing a radio show before.
Not a good idea.
No. There is differences in different professions. It's probably largely how much time you spend at your desk and how many people come into your office from what we see on that. We can go down to where they
Very
do
interesting.
The viruses. This is bacteria.
All right, we're in the bacteria lab, and we are heading over to the virus lab.
This is a virus lab here. And we work with viruses like influenza virus, cold viruses, viruses that cause diarrhea. This is kind of a unique year this year, is that the flu season and the diarrhea season peaked at the same time. Yeah. So it's kept us a lot of interest in busy this time of year. It's kind of rough to sneeze and poop in your pants at the same time. But that seems to be kind of the trend that we have this year. So it's a little bit harder to handle in terms of analyzing samples. During this season, we like to do a lot of work because there's more contamination in indoor environment for a lot of different viruses and that. Let me just show you. These are cell culture. To grow viruses, you have to grow them in animal cells, and this is rotavirus in this one. This is the major cause of childhood viral diarrhea. Every kid gets this. This is the kind of ooze out your diaper diarrhea.
Thank you.
From my experience. And kids usually don't do that until you put them into a shopping cart.
There you go. And then you put your food in the shopping cart seat, right?
Well, I mean, years ago, 35 years ago, you couldn't grow this virus in the lab, so I used to save all my children's diapers every time they...
Oh, my gosh. Your kids probably loved you.
Well, no, it caused a couple of problems because every time they had diarrhea, I took their diapers and put it in the freezer until I went in the morning. So one day I opened up, my wife says, you got to check the freezer out, and it was full of frozen underwear when they got older because they thought that's where the underwear went.
That's what I thought.
So I had to sit there and chip out all their underwear one day.
This is too crazy.
Yeah, I know.
How many children did you have?
Oh, I had two. Yeah, children. That was enough.
There's not enough room in the freezer.
Yeah, that's right. Yeah, that's right.
What are these?
Well, these are the same thing. This is a blue dye that stains living cells, and I would guess this is probably a polio virus, which we use a lot for studies. But we work with viruses here, like I said, influenza, hepatitis A virus, rotaviruses. Also, norovirus, which causes diarrhea.
Food poisoning.
Yeah, food poisoning. Number one cause of food poisoning. 60% of food poisoning is due to norovirus.
The norovirus?
Yeah. The curse of the cruise ship line.
Absolutely. Someone told me that at the bottom of the CDC building that they've got the Spanish flu from 1800 still alive.
That may be true. I knew they were looking for, they have clinical samples that go back that far. We have samples from outbreaks from many years ago. We keep them for reference. And somebody always discovers a new way to look at them or analyze them. Mm-hmm. And so you always like to keep material around for doing that all the time. But the virus work is a little bit more involved, takes more effort, takes a longer time to actually do. But they cause most of your common infections because it takes so few to infect you, usually 1 to 10, where it usually takes thousands of bacteria to infect you. So that's why just a few viruses on a surface can cause a problem and why we so readily get infected all the time. Also, they evolve all the time. Not everybody believes in evolution, but microorganisms do, and they keep evolving to get around your immune system all the time. So the same thing with noroviruses. They evolve, or cold viruses. That's why you get them all the time. I mean, basically, you're their food supply, and so they keep changing to make sure they have something to eat.
Which is interesting. I think I asked you this once before, but people continue to ask me this, that, why should I sanitize my hands so much? Are we creating a situation? Shouldn't my body be strong enough, or don't I build up immunity? And I think you said that because of the evolution, they're always evolving into a different strain.
Right. They keep evolving. They keep getting around your immune system all the time. So that's why good diligence, I think, is always important because they're always evolving. And our population's evolving, too. Like we're a population probably more sensitive to getting seriously ill and dying from common infections. Like in the developing world, most of the people who die from diarrhea are children under 5 years of age. In the United States, it's mostly people over 55. 70% of diarrheal deaths are people over 55. So the best present for your retirement party is bottle of kaopectate. You could save that person's life, right? But most people don't realize how important that becomes in different age groups as we mature.
That's something I hadn't thought about. That's good information.
What it comes down to, if you look at most of the people who die with common infections, it's people over 55, children under 5, immunocompromised people, and pregnant women. Those are the 4 susceptible groups for more serious illness. That's about 1/3 of our population at any time. Now, most people don't realize you're going to be young and you probably be elderly eventually. You're going to be in those groups too. And there's more of us in that category than ever before because people are living longer. We treat common diseases. Now, in the United States, the 3rd leading cause of death is infectious microorganisms. Again, they kind of work their way back up. We only die more commonly of heart disease and cancer. And I have no doubt sometime in this century, microorganisms will be on top in the United States because as we get better treatments for heart disease and cancer, and we learned that some of the cancers and heart disease are microorganisms, I think they're going to be back up there again.
Interesting.
But it's a good problem. Controlling infection spread in hospital is a major problem and concern. I mean, the best thing I can say is get out of a hospital as fast as you can.
Right. Don't go in.
Yeah, don't go in. You're more likely you're taking increased risk, at least, by going into hospital. I'm actually, some people ask me, were there 2 places you're afraid to go in? I said, 1, a daycare center, worst place you can go in, holy cow, because there's every disease known to mankind there, and 2 is a hospital because of that.
With that in mind, what are your thoughts about scrubs out in public?
I don't think they should take them out in public scrubs because when we find they get contaminated, at the end of the day, they contain a lot of different organisms, particularly antibiotic-resistant organisms they're taking out in the community. I don't think physicians should be allowed to leave the hospital with scrubs on. I don't know why they don't allow that. We've actually found in our recent studies, too, one of the germier places in terms of antibiotic-resistant bacteria is the cafeteria in hospitals. Because they're all going down there eating in their scrubs, and they don't go through the same cleaning and disinfecting routine in the cafeteria they do in the rooms. So I think that's a point where you can get a lot of exchange of germs. So I don't eat lunch with MDs anymore.
I'm glad you said that because I've been talking about scrubs out in public. I just don't understand why hospitals think it's the nurse's obligation to go home after a double shift and they're going to wash their clothes in hot enough water and the proper detergent.
Yeah, we found out they don't really get them that clean because you really need very hot water and you need bleach to really do a good job. And what we've seen, people who take their scrubs home and wash them almost have as many microorganisms as the ones who at the end of their shift. Mm-hmm. So there doesn't seem to be a lot going on there. So I think it's the responsibility of the hospitals take care of that rather than depending on individuals.
And then imagine what they leave behind in the washing machine for their family to pick up on their clothing.
Right, that's a concern that when you put any type of contaminated clothing in a washing machine, it cross-contaminates it. So, I'd be more worried about them contaminating their family, too, because particularly with using cold water and short dry cycles today, that's a real issue. Yeah, I mean, we only have a 12-minute wash cycle in the U.S. In Europe, it's 140 minutes. Did you know that? And that you can turn the water up to 180 degrees Fahrenheit. I mean, your clothes come out really clean. Of course, they're about 2/3 the size. Yeah, and they're a little faded.
Little tiny people.
Yeah. You don't want to put your white underwear in with that clothes, though, because it'll be whatever color came out, We've tested a few of those and go like, whoa.
Pink underwear?
Yeah, pink underwear. Yeah, coming out of here. But you really get them clean. Yeah. You really get them clean. Yeah. Oh, me too, yes.
Golf shirt. Put it in the washer. Had my underwear with it. Had hot water on it. I had the pinkest underwear you got.
Yeah, oh, me too. That happened to me exactly. Same thing. I go, oh, great.
Well, at least not too many people are going to see your underwear.
Right. If I ask you, what's the knife? What are they growing there?
Yeah, what in the world they got in there?
Oh, that's just lunch.
Okay. Oh, my God. Hey, Akram, what the heck is this knife doing in here? Is this an experiment?
Where?
In here.
Or is that just peanut butter on your knife?
This is really for dishes. So.
Are you going to use that?
This is one of those dirty
dishes.
They actually should use
it.
Looks like a new life form growing.
Whatever it is, it's growing.
Yeah.
It's doing a good job.
Yeah, good job.
I don't know. This is crazy.
Well, thanks, Dr. Chuck Gerba, for a very cool afternoon. As a bit of a recap, here are a few things Dr. Gerba talked about that really caused me to say, oh, I didn't know that. He talked about how hospital cafeterias carry more bacteria than hospital rooms because healthcare providers are eating their meals there while still wearing contaminated clothing, combined with the fact that the cafeteria does not disinfect the same way a patient room gets disinfected. I highlight this during my presentations. Cross-contamination. Remember this when you visit someone in the hospital. Bring your own lunch and eat outside. And when you go home, remove your clothes and shoes at the door. Run through the house naked if you have to, or keep a clean robe or a change of clothes at the door. But whatever you do, don't bring hospital germs into your home. And he said that radio people were the germiest of all media folks. I know he didn't mean me. Hey, Bob, pass me a bleach wipe, would you?
Jerry the Gerb with
Excuse me, Jerry. Hello, everyone. This is Mama Josephine Germophobia. Jerry's a mama. Last week, I made my debut on this radio show, Speak Up and Stay Alive. Oh, so many of the people call to say thank you for apologizing for my son's bad behavior. I no teach him to be so dirty and spread the germs, but he no listen. He no cover his sneeze. He cough into his hands and then touch everything. So again, Jerry, do your mama proud. Be a good boy and say the right thing.
Stay safe. Listen to Speak Up and Stay Alive Radio. Tune in every Saturday morning. For more information, go to speakupandstayalive.com.
And Jerry, wash your hands.
You are listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rouleau, so happy to share our holiday charity radio event. As you know, we make and send handmade one-of-a-kind pillowcases to our troops overseas. Just a gesture to say thank you for fighting for our freedom. And here is one of our sponsors of this project, Hospice of the Western Reserve. You've heard them on this show before, as I've told some stories about my family members and friends who have used this important and peaceful resource.
Dealing with my father's illness was full of difficult decisions. Hospice of the Western Reserve gave me the peace of mind that I made the right choice.
Discover why the hospice of choice is Hospice of the Western Reserve at hospiceofchoice.org.
I encourage you to get to know the folks at Hospice of the Western Reserve. You do have a choice. Visit them at hospiceofchoice.org. And a big personal thank you from me to them for supporting our troops and our pillowcase project. When it comes to chiropractic care, many people shy away and have anxiety about having their body contorted or their necks twisted. At Roediger Chiropractic, you can relax. Dr. Roediger uses a gentle, low-force chiropractic tool known as the activator to make adjustments along the spine. Listen as I spend the next 2 minutes with my friend, Dr. Tad Roediger. He's quick, easy, and painless. So, Dr. Roediger, how is the activator method different from the common manual adjustments that include the bone-popping snap, crackle, and pop?
I get that question all the time, and I did manual adjusting for 10 years, and I'm very good at it. When I came up here to Chard and opened my own practice, I picked up the activator technique. The activator is a handheld device that gives a controlled bump into the joint. It has some different settings for different pressures, but it is actually a manual device. It actually manually moves the bones, but it works more on speed than on power. Much like if we use a bullet analogy, if I take a bullet and throw it at you, nothing's going to happen. Add some speed to it, something's going to happen. So that's how the activator works. But more importantly, with the activator method is the way of assessing the patient. doing different tests each time the patient's in to see which vertebrae need to be adjusted, which direction they need to be adjusted, and which vertebrae don't need to be adjusted. When the patient's laying on the table, there's different motions that I can have the patient do. Putting an arm behind their back or an arm up by their head will stress different vertebral levels. And if that level needs to be adjusted, it's going to cause a reflex causing one of the patient's legs to appear shorter. Now, I know it sounds weird, but it's kind of like the body saying, ow, and it tightens up. And this is what causes the leg to appear shorter, just for a brief period of time. But it's long enough for me to see it and to say, that's an area that needs to be adjusted. If you've never thought about having chiropractic care, try it. Or get checked at least to see if it might be something that might benefit you. You never know what medical ailment it might help.
And I thank you so much for sharing your advice with us today, and we look forward to your return next week.
Oh, thank you for having me, Pat. This has been awesome.
I encourage you to visit Dr. Roediger for a consultation. Call him for an appointment at 440-285-0756. Dr. Roediger is located in Chardon, Ohio at the Village Station, 401 South Street, just 1/2 mile south of downtown Chardon off of Route 44. Or you can always call him at 440-285-0576. You are listening to Speak Up and Stay Alive RadiOh. I am your hostess, Pat Rulo. So happy to spend this hour with you to help you survive any healthcare or hospital encounter. Well, folks, the boys are back with their ice cream cone-shaped squeaky dog toys in hand. I guess that can only mean one thing. They are ready to head over to the game chamber and play the silliest game ever, Squeak Up and Stay Alive. This game started innocently enough when I mentioned a few weeks ago that the squeaky wheel gets the grease and how we can transfer this idea to a hospital stay. So, for example, if you get a medication that doesn't look the same as the last medication, get squeaky. Ask questions. And if you don't know why the nurses won't let you get out of bed, get squeaky. Ask questions. Here's how it goes. I will read a question from our squeaky question chamber, and Bob and Jeremy will squeeze their squeaky toys when they think they know the answer. The first one to squeak will get the chance to pick the next category of questions with the hopes of winning the grand prize. The winner gets to keep their ice cream cone-shaped squeaky dog toy and the fabricated championship belt. Jeremy is saying, yeah. Bob has laid claim to the chocolate cone. Let's hear your squeak. And Jeremy, my favorite, the vanilla cone. Best squeak ever. So are you radio rivals ready to play everyone's favorite new game, Squeak Up and Stay Alive?
Ready, willing, and able. Let's do this.
What are we waiting on?
All right, let's do it. Here are the 3 categories. What we talked about on today's show, healthcare-acquired infections, and we got a new one, when dangers are strangers, and we'll add the grab bag. Today, Jeremy won the pregame toss, so he begins. What category do you want to start out with, Jeremy?
You know what? The new one sounds interesting to me, so let's start, and I have to say it like this. When dangers are strangers.
Oh, I knew you were going to pick that one. All right, here we go. The Squeak Up and Stay Alive question number 1. When this danger is a stranger, you'll have recurring diarrhea, especially if you've recently taken antibiotics. Bobby.
Oh, that's real easy. That's got to be C. diff.
Yes. The C. diff bacterium takes hold typically in a hospital, rehab, or a nursing home setting and is spread when people do not wash their hands properly. A dangerous and deadly situation. And remember, hand sanitizer does not kill the C. diff bacteria. So do either of you know what does?
You got me.
Do what?
Bob wasn't listening.
No.
Good old-fashioned hand washing. Bobby, I'm disappointed, but you do get the point, and you get to choose the category.
I'm interested in the grab bag this time.
Okay, here we go. The Squeak Up and Stay Alive grab bag question number 2. The kidneys filter your blood up to 300 times per day. Oh, Jeremy.
I'm going to say that is true. Those poor little kidneys have a whole lot of work to do.
Yes, that is true, Jeremy, and it is a lot of work. So guys, be kind to your kidneys. Keep your kidneys happy by following these kidney tips. Control your high blood pressure. Control diabetes. Stop smoking. Lose weight if you have to. Eat a healthy, low-salt diet. Exercise for at least 30 minutes, 5 days a week, guys. Limit your alcohol. And don't use over-the-counter pain relievers such as Advil, Aleve, and ibuprofen. So, Jeremy, you get the point and get to choose the next question.
I got to go with it again. I like it when dangers are strangers.
Oh, this is a weird show, folks. The Squeak Up and Stay Alive question number 3. In the early stages, when this danger is a stranger, and especially during or after a hospital stay, you may notice small red bumps on your skin that can become red, swollen, and painful. What should you rule out? Ooh, that's fast. What do you think, Jeremy?
A spider or bug bite?
Oh, Jeremy, that might be the first thing to rule out, but what we're looking for is a staph infection. You may also develop a fever as your body tries to fight off the infection. More serious signs of a staph infection can be chest pain, cough, fatigue, headaches, muscle aches, and shortness of breath. Be mindful of a MRSA infection both in the hospital and in gyms where people share equipment. So no one gets the point. Bob controls the category. What do you want, Bob?
I'm going to go to today's show.
All right. The Squeak Up and Stay Alive question number 4. Sleep apnea and anesthesia don't mix. So if you have any signs of this sleep disorder prior to any surgery, you should do what? Bobby.
I think you need to ask your doctor about sleep studies and answer the question of stop bag questionnaires.
The stop bang questionnaire. Yes, Bobby, you're good. And for more information about sleep apnea and the stop bang questionnaire, visit the free stuff page at our website, speakupandstayalive.com. Bob, you get the point and control the category.
I'm going to stay with today's show.
Okay, it's a safe one. All right, the Squeak Up and Stay Alive question number 5. According to our guest, Dr. Chuck Gerba, the germiest desk can be found at which profession? Bob, you were there. Do you remember?
Oh, I remember what he said. He said school teachers are terrible.
Yes, and do either of you remember the least germy profession?
The least germy profession? Lawyers?
Yes, yeah, a lawyer. I think he said because they're always out on the golf course.
Oh, I believe that now, yes.
So Bob gets a point and chooses the next category.
Oh, let's see. I think I'm going to stick with healthcare acquired infection.
All right, Bobby's mixing things up here. All right, here we go. The Squeak Up and Stay Alive question number 6. Many healthcare acquired infections could be avoided if everyone did this. You know the answer, Jeremy.
I know this one. Wash their hands.
Yes, such a simple solution to a widespread problem, Jeremy. Well, folks, the score is Bob 3 and Jeremy 2. And with such high stakes, our fabricated championship belt that carries a lot of weight and prestige around here. Let's get to it, you radio rivals. And Jeremy, you choose the final category.
I'm going to go back to the grab bag.
All right, he's using some excellent strategy here. The grab bag has some strange questions. Okay, get your squeakers ready because here is the final question. The Squeak Up and Stay Alive grab bag question number 7 is a true or false. Here we go. You get a new stomach lining every 3 to 4 days. Bob.
I have nothing to lose, so I'm going to say false.
Aha, that is true, Bob. And if you didn't get a new stomach lining every 3 to 4 days, the strong acids in your stomach that are used to digest the foods would also digest your stomach. So I guess if something or someone makes you sick to your stomach, just wait a few days and you'll get a new stomach lining.
That works out well.
Well, let's add up the score. Bobby, I declare you this week's winner. Jeremy, can you take that championship belt off the wall? Bob's pants have been a little droopy this week without the belt.
You need these for has anybody made
My suspenders have wore out.
Here you go.
So do you have any more to say about this?
I'm upset, but I lost to a great rival in Bob, so I'm happy about that.
And you learned a lot.
That's right. Correct. I was going to say you're both winners, and so are our listeners. Thank you, radio rivals, for playing our exciting game of Squeak Up and Stay Alive. Let's give ourselves a round of squeaks. So remember, the point of this game is the squeaky wheel gets the grease, or in this case, the squeaker gets the prize. So feel free to speak up or squeak up at every doctor visit or hospital visit. That's the best and only way to get the attention you deserve. Coming up, more of what you've come to expect from America's favorite healthcare and hospital survival radio show, Speak Up and Stay Alive Radio. On this show, we talk about the need for a patient advocate during every healthcare or hospital encounter. But advocacy also includes whom you rely on when it comes to health insurance. And when it comes to your Medicare supplement plans, you must compare. Listen while I spend the next 2 minutes with Chris Alberta, the Medicare supplement partner with Generation America, as we discuss the importance of choice. Chris, can you tell us how are you and Generation America different when it comes to choosing a Medicare supplement plan?
As opposed to looking for an opportunity to hook up with one carrier or a company with a couple of products, what they said to us was, how can we offer everybody who's a member of our organization basically a menu? Many people don't know this, is all these Medicare plans, most of them are exactly the same coverage. Only difference is the price that you pay. And so what our organization does anyway is that we work with probably upwards of about 50 different programs and carriers around the country, which is most of them. And Generation America hooked up with us and said, listen, how can we show our members every single program that's available in their zip code and then really break it down according to age and price so they never end up overpaying?
That is great to know. People need choices and they need to feel safe when they make those choices. So how can our listeners find out more and where can they purchase the proper Medicare supplement for themselves?
Well, the website generationamerica.org is the main portal. That's the front door really for that team.
Well, thank you for spending the time to clarify Medicare supplements with us today, Chris.
No problem, Pat. Thanks for having me.
For more information or to join, visit generationamerica.org. We're listening to Speak Up and Stay Alive Radio every Saturday morning in Cleveland, Ohio. I am Pat Rouleau, your hostess and author of the book Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide, available at all of our live speaking events or at our website, speakupandstayalive.com. That's where you can also locate radio show times, dates, and station information. That's speakupandstayalive.com. Keep in mind, this information is so important to each one of us. Hospital hazards are not confined to a particular group of people. Harmful bacteria, mistakes, and miscommunication errors can find anyone. Don't let them find you. So if you're looking for a meaningful way to help your members, I am happy to speak to your group, but be sure to get a hold of me soon. Call me right after the show, 440-725-5462, or email speak at speakupandstayalive.com. Today, we talked about sleep apnea and why it's important to know if you have this sleep disorder prior to any type of surgery. Anesthesia can be dangerous if you have sleep apnea, and it pays to discuss the risks with your surgeon and anesthesiologist prior to a hospital stay. And we brought you along on our audio tour of Dr. Chuck Gerba's microbiology labs. Too much fun for such a serious topic. Now, if you missed some of today's show, you are a risk taker. Or if you simply want to replay it for yourself or a friend in need, go to the radio link at the speakupandstayalive.com website to listen to today's program. You might want to do that anyway, just to help you remember more of today's revealing information. And be sure to listen next week as we continue to entertain while still sharing very important life-saving tips and tools to help you and your loved ones stay safe during any healthcare or hospital encounter. And send us your questions or comments on any topic pertaining to healthcare and hospital safety, and we will read or answer them next week. That's next Saturday morning, where you can find us in Cleveland, Ohio, from 7 to 8 Eastern on AM 1420 WHK, and from 9 to 10 Eastern on AM 1220 WHKW. Or listen live via the internet Check the SpeakUpAndStayAlive.com website to find out how. In the meantime, I hope you have a happy and a healthy week. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
The information provided in today's broadcast is for informational purposes only and was not intended for use as diagnosis or treatment of a health problem or as a substitute for consulting a licensed medical professional. Participating as a program listener, guest, or caller should not be considered medical advice. References to any entity, product, service, website, or source of information should not be considered as an endorsement. If you missed part of today's show or just want to share the information with friends, you can download a copy of the show at SpeakUpAndStayAlive.com. That's SpeakUpAndStayAlive.com. Want even more information? Purchase a copy of Pat's book at the Speak Up and Stay Alive website. Once again, it's SpeakUpAndStayAlive.com.
This is Pat Rouleau. When you get a chance, become a friend and like us on Facebook. We're called Speak Up and Stay Alive. Then post your questions and comments on our Facebook wall. We may read them next week. Who else do you know who can benefit from this life-saving information? You can keep your group, club, business, or church safe from hospital hazards. I speak live and in person too. Our events are fun, fast-paced, interactive, and jam-packed with serious information. Your crowd will love it. Just email me at speak@speakupandstayalive.com or call 440-725-5462. Until next week, remember to ask others to wash their hands. You have to speak up and stay alive. Call me, email me.
Thank you. Thank you very much. Thank you. Thank you. Thank you.
Brought to you by Generation America, the smart and traditional 50-plus membership organization. And they provide a full range of benefits to members. If you're looking for quality Medicare supplement, their rates are lower than the other 50-plus organization, Generation America. To join and to find out more, visit generationamerica.org.